Hi there, my name is Candace Schreiber and I am a dietitian at the Ohio State University Wexner Medical Center. And I'll be doing the presentation today on nutrition while living with metastatic colorectal cancer. So we'll go ahead and start with why nutrition is important for cancer survivorship. And it really helps provide the nutrients your body needs to heal from treatment, maintain your strength, and hopefully get you to help feel better. So when you have good nutrition and you're eating, you're kind of feeding your body good nutrients, you're helping your body heal from the array of treatments that you might have gotten, and so you might not be feeling well right now, but consistently eating well can help improve any kind of side effects or any kind of problems that have arose from treatment. So we'll go ahead and dive into side effect management, and I'm going to spend the majority of the time talking about various side effects that may have occurred. This is a very individualized thing. So some people, experience certain side effects, some people don't experience any. It's really individualized based on what kind of treatment you've gotten, what cancer drugs you've gotten. So I'm going to try and touch on all the possible side effects that people may have gone through or still be going through. So we're going to go ahead and start with one of the most common side effects, that's nausea. I don't think I've ever talked to a single cancer patient that hasn't dealt with nausea at some point or another. So nausea with a combination of feeling full. One of the things that we really recommend is small, frequent meals. So instead of eating, the 3 meals a day, it's really more of a 5 to 6 meals a day that we encourage. And this might be something, making meals at scheduled times might be a little bit easier to get those nutrients in. Sometimes I'll tell people if they're not feeling well or their appetite's kind of poor is to set a timer. That way, every few hours you're eating something, because sometimes you might not have those hunger cues anymore. And so you might need just to eat by the clock to make sure you're getting, the calories and protein that your body needs right now. Keeping easy things on hand, ready to eat foods, string cheese, peanut butter crackers, things like that you really don't have to prepare, will help you, again, get in those nutrients that you need. Drinking liquids in between meals, not with meals. So this helps with the feeling of fullness. If you are feeling full already, you don't want to be drinking liquids with your meals because those liquids are going to take up space in your stomach. You want to leave that space for meals and not drinks. You can certainly drink between your meals, but just avoid doing it with your meals if you are feeling full. Avoiding any kind of fried, greasy, high fat foods. This isn't going to make you feel very well, and it might even decrease your appetite further. So try, basic, plain, bland foods to start with. If there's any certain smells or foods that trigger nausea, definitely avoid those. Make sure people in your house know about that so they don't cook those foods, because that really impacts your appetite and your intake of food when you're smelling and experiencing that nausea. Anti-nausea meds, 30 minutes prior to meals. Stay on your prescribed regimen, even if you're feeling well. The reason you're probably feeling well is from those anti-nausea. So stick with it. Continuing use of those will help, again, with that intake and ease that nausea. If you have a good time of day, some people wake up better, some people go to in the evenings, feel better, maximize on this and try to really consume a lot of your calories in that time frame. Even if, don't eat if you're vomiting uncontrollably. If you're just nauseous, I do encourage you to eat because that nausea might be lasting a long time and you can't just stop eating. So if you're nauseous, I would say still eat those small little meals, but if you're actually vomiting, then you don't want to consume anything. Just call your healthcare team. Lemon, ginger, candies, those things can help. Tea, iced or hot, can sometimes help with that nausea. Carbonated beverages. Smoothies are wonderful. I encourage those quite a bit when people aren't feeling well. Sometimes it's easier to drink than it is to eat, and you can really get in a lot of calories with smoothies if you need to. There's not much odor with them. You can adjust the flavors to what you like, and they also make you feel a little bit less full if you are experiencing that feeling of fullness often. These are just some ideas for a smoothie. And so based on if you're using a smoothie as a meal or snack, you can kind of adjust the amounts in these. So if you're doing, again, for a meal, you might want to head towards those 2-cup sides versus the one cup or 1 tablespoon side for just a snack. So these are just, again, some ideas. It's not the only things you can add to a smoothie. There's lots of other options, but just some things that, are pretty popular that taste good. If you need to increase your calories, those nut butters, the chia seeds, those types of things are an easy way to add in more calories and get more, calories per bite. Taste and smell changes. So if you have a metallic taste, plastic utensils, don't drink out of a can, try some mints and gums before you eat. Bitterness, try some honey or something sweet. You can kind of drizzle a little bit of sugar. Bland, use your lemon, citrus flavorings, spices, herbs. I do often encourage people, if you have a store around you that sells fresh herbs and spices, especially if you're having a lot of taste changes where things don't taste good to you, I will say fresh herbs and spices make a big difference between, the $1 ones that you get at the grocery store. Fresh ones have a much more potent taste. And so if you are just at the point where nothing tastes good, try using some of those better herbs and spices on your foods and see if that helps. You can do like a rinse wash before you eat if you are having those taste changes to kind of help clear your mouth and make it, more palatable for the foods. Room temperature foods are going to be better than hot because they're not going to have a strong odor. Fresh fruits and vegetables are often more enticing for people than frozen or canned. You can certainly use frozen and canned if they taste good to you. There's nothing wrong with those foods. I just often find that people like the taste better of those fresh fruits and vegetables, but that's, again, your personal choice. For meats, that's another thing that I see a lot of people say that the taste and flavor has changed, so you can try marinating them or choosing other protein sources. You don't have to use meat to meet your protein needs. You can certainly use plant protein. So as you can see, those are just some protein types, foods with various amounts of protein, animal versus plant. So again, you don't have to be eating meat to get your protein. You can certainly get your protein through other sources. Dry and sore mouth, moist and soft foods with gravies or broths or soups are going to be a really good choice. Again, with the smoothies, if you kind of suck on some candies before you eat, that can help moisten the mouth a little bit. Making sure you're drinking enough water, also foods that are high in water content, so citrus foods. These might be painful if you have mouth sores, so I just caution if you do have any kind of sores in your mouth, don't choose the citrus foods. Magic mouthwash is something that's often recommended for using, and then there's other kind of lozenges and things like that to help with dry mouth. So if you are having that, don't just suck it up. Talk to your healthcare team and see if there's something that you can do to help with that. For constipation, so there's a lot of GI symptoms that can result from colorectal cancer and treatment. So as far as constipation, again, there's medications that can help, so discuss that with your team. The 3 F's, so fluid, fiber, and physical activity. These are all things that can help with constipation. Drinking water throughout the day, exercising can all help. So foods that are high in fiber, so fruits and vegetables are going to be key. Those are going to be, good fiber sources. Making sure you're eating the whole fruit and vegetable. Don't peel the skin or anything like that, because that's going to have a lot of that fiber. Whole grains, nuts, popcorn. Starting your day with oatmeal. That's a really good fiber source as well, so that can kind of help with constipation. And if you are increasing the fiber in your diet, make sure you're drinking extra fluids. And then again, exercising if you can. For diarrhea, still drinking plenty of fluids. You may need something with electrolytes to replace the electrolytes that are being lost. Foods high in salt, pretzels, broth, crackers, soups, those kinds of things can help with the sodium that you might be losing. Small frequent meals, that's going to be key again. So those 5 to 6 small meals and snacks per day, avoiding large meals. Again, the trigger foods, anything that's super greasy or fried, high fiber foods, so those whole grains that you often may hear people say that are healthier, you'll want to avoid those for the time being at least, until the diarrhea starts to improve. Again, medication might be needed, so keep your team informed. So for diarrhea, sometimes a low fiber, low residue diet might be prescribed. And so these are just some things to eat and to avoid. It's certainly not a comprehensive list, but just to give you kind of some ideas. As far as fruits and vegetables go, I would make sure you're choosing ones that are, well cooked or canned are a better way to go versus raw or undercooked vegetables. And, tender meats, eggs, smooth peanut butter, again, the white breads and pastas versus the whole grain varieties. Again, just for now, while those symptoms are occurring. Another thing to increase, so I know I said low fiber, but soluble fiber actually helps with diarrhea. And so these are foods that are specifically high in soluble fiber that you could consume to help. Oats, barley, certain fruits. So those fruits on that list, they are good sources of soluble fiber. Potatoes are another one. So these could be things that you start including to help with that diarrhea. Because what soluble fiber does is it kind of binds and creates a gel. And so that helps bulk things up and can help improve that diarrhea. If you're dealing with weight loss, using calorie-dense foods is really going to be important. Peanut butter, nut butters, avocados, olive oil, canola oil, things like that. Sometimes I'll tell people, just add a tablespoon of olive oil to whatever you're eating. It won't really change the flavor. It's just going to add those calories, which are going to be really important. Sometimes we have people that go through treatment and they'll lose weight and they'll say, well, I could stand to lose a few pounds. It's not really the time to lose weight when you're in treatment or freshly off of treatment. Give yourself some time. And once you start feeling better and if weight loss is something that you want, you can do it, once things are improving health-wise and you're feeling better. Eating on a schedule, counting calories, these are all things. If you want to count calories and you have a certain calorie number to hit, I would definitely talk with a dietitian first to see what your needs are. Liquid nutrition, so those Ensures, those boosts, those can help too if you just need to add weight. Drink those between your meals and those can be helpful in increasing weight. For fatigue, make sure you're getting in those calories and protein and hydration. Dehydration alone can cause fatigue. So if you're not drinking enough, you're going to feel tired. So any way you can, drink some water. Sometimes it helps to actually have a water bottle with a straw. That often gets people to drink more throughout the day. Eating more frequently if you need to. Exercise actually does help with fatigue. So taking a walk and get your body moving. Asking for help is important too. If you don't like plain water, you can try some infused waters, lemons, limes, berries, mint, anything you like, put it in water, and sometimes that'll make you drink it a little bit more. As far as food safety, this is important, especially for immunocompromised people, but really just anybody. It's important to keep your food safe, not eating any raw or undercooked meats or seafood or undercooked eggs, not drinking anything unpasteurized. So there's some, stores and places that offer fresh juices, but a lot of those aren't pasteurized. So I would make sure you stay away from those and just buy things that are pasteurized. Washing your fruits and vegetables well, you don't have to avoid eating these. Just wash them with just running water for 20 seconds. You don't need any kind of sprays or certain solutions, just water. Not keeping leftovers very long, 3 days max. Store foods properly. Avoiding salad bars and buffets. If you're immunocompromised, that's a good idea. But it might be something you want to limit still. And if you ever think something doesn't look good, then don't risk it. Some general tips, again, eating by the clock. If you can't rely on your appetite anymore, we want you to get those calories and proteins. Sometimes you need to think of food as part of the treatment process and part of your medication, where it's just something that you do at a certain time every day, especially if you're not feeling well and your appetite's not good. You need to eat by the clock. If you exercise before your meals, if you can, that'll kind of help with that appetite. Planning meals in advance. Maybe if you plan your meals, you won't have to think about it all week, every day. You only have to think about it one day a week if you plan it for the week. Again, asking for help, making your meal times pleasant, stay hydrated, and be kind to yourself. Coming off treatment, you might not be feeling well, and so don't start making all these changes all at once. Do things gradually. Give your body time to heal. As far as ostomy care, a couple tips I'll go over here. Avoiding high fiber foods the first few weeks after surgery, depending on what your doctor says, but most people can resume diet about 2 to 6 weeks after surgery. So that's going to be a little bit individualized. You'll just have to see what works best for you. If you have a reaction to certain food, it's not that you can never have that food again, but you'll want to cut it out for a couple weeks and then slowly reintroduce it to see how your body reacts. Again, with the smaller meals, this is another thing it's important for. Small bites, chew thoroughly is important. Drinking plenty of fluid, but avoiding straws. If you do have a high ostomy output, 1,500 to 2,000 milliliters a day, contact your team. If gas is a problem, these are certain foods that you can avoid. I wouldn't avoid these foods unless you're having problems with gas. I don't want you to avoid things unnecessarily. So this is really just if you are having these problems or you notice maybe one of these foods cause gas, then you can avoid them for a while. So plant-focused diet is what we'll talk about next. So this is what we recommend. If you're feeling well after treatment and you're not experiencing a ton of side effects, the type of eating pattern that you want to kind of get to is a plant-focused eating pattern, which is composed of whole plant foods. So it's not a vegetarian or vegan diet. It's just really focusing on those plant-based foods and doing smaller portions of so focusing on those vegetables, eating more vegetables is really, really important. More fruits, whole grains, beans, nuts, seeds, those types of foods. You can certainly still have meat and dairy. They should just be in smaller portions. Limiting really highly processed foods with a lot of added sugar or salt or fat. And also trying to get a colorful variety of foods. So eating, trying to check off every color of the rainbow every day that with fruits and vegetables, eating all those colors every day if you can. What are the benefits? So the benefits of this style eating pattern is getting all the vitamins and minerals that your body needs from food. Phytochemicals are really important. These are compounds in plants that can have benefits to our bodies. Fiber, which can help normalize bowel function. Fiber also can reduce risk of various diseases. Lower calorie, which can help control weight, which is important, and then healthy gut bacteria as well. As I mentioned, those phytochemicals, those are just compounds in plant foods that give them their smell, their color, their taste. So the green and grapes and kiwi and the purple and eggplant, those are all come from their phytochemicals. There's thousands out there have been identified, and these compounds can have benefits to our bodies. And so we want to get as many colorful foods as possible. Fiber is just part of the plant that your body can't digest. What's recommended is about 25 to 35 grams of fiber per day. And we do encourage that from foods, from whole foods versus foods that have added fiber in the form of bars and cereals and things like that. We want you to get your fiber from whole plant foods. There's two different types of fiber. So and I already mentioned this with the GI symptoms, but if you're having, constipation or diarrhea, you can focus more on insoluble or soluble fiber. These are just some sources of those to look at. If you aren't experiencing any GI symptoms, then just getting kind of a balance of both of those fibers is what's recommended. And you can see on that list there what foods are highest in fiber. These are just some options. It's not a complete list. So there's certainly other foods, if you're looking at that thinking you don't like a lot of those foods, there's certainly other foods that are high in fiber that you can get as well. So red and processed meat, this is something you want to reduce in the diet because red and processed meat can increase risk for colorectal cancer. So it's something that you want to reduce. The three questions I'll kind of talk about for this are what red and processed meat are, why it's important to reduce these, and how to reduce these and what to replace them with. So what is considered red and processed meat? So red meat is beef, pork, and lamb. And I do point out pork because a lot of people think that that's a white meat, but it's actually a red meat. Processed meat, that's anything that's preserved by smoking or curing or salting or any kind of added preservative. So this is going to be your deli meat, your hot dogs, your sausage, your bacon, brats, things like that. In regards to red meat, no more than about 12 to 18 ounces per week is what's recommended. So this can still be included. When you look at your meal, you want about a quarter of the plate to be meat, if you're choosing meat, and about half of that plate to be vegetables, and then another quarter of it to be whole grains. So if you are choosing red meat, just keep it to small portions and under that 12 to 18 ounces per week. As far as processed meats, there's really no set recommendation because any amount can increase colorectal cancer risk. And so these pose more of a greater risk than red meat. So try and limit these as much as possible. Why do you want to limit these? There's no sound, complete, well-known reason why these increase risk, but these are some ideas of why they can increase risk for cancer is the compounds that the meat creates when it's smoked or cured or when the nitrates are added can cause cancer. The heme iron in red meat can damage the lining of the colon. Cooking meat at high temperatures creates compounds that can cause cancer. And so this is, you might have heard about grilling meat. It's because it's such a high temperature. And then eating red meat can also promote inflammation, and chronic inflammation is not good for our bodies. So how do you reduce red and processed meat? Leaving these things for special occasions, birthdays or celebrations, or, if you're at a baseball game, you can have a hot dog, but things that are more infrequent. If you do eat raw or red meat more regularly, just keep the portion small and then look at what you're pairing it with. So if you're having red meat, pair it with lots of vegetables, and just keep those portions a lot smaller. If you are someone that eats, a turkey sandwich every day, that might be something that you want to adjust a little bit. One thing that I've done is using, fresh chicken breasts. You can cook those in the oven and then shred them and use them how you would lunch meat on sandwiches or in wraps. Trying one meat-free day per week can help reduce animal products and red meat in general. And then utilizing different protein sources. So instead of meat protein, aim for more lentils and beans, soy products, things like that. And, your white meats, your eggs, those are all good protein sources as well. Two questions that we often get that I wanted to address about red and processed meat is sometimes people ask, if I buy the nitrate-free or uncured products, is that better? And the answer is no. The evidence doesn't show that those products are any better. So we do still say to limit those products. They might be advertised, you know, as uncured and things like that, but they still should be on occasion. As far as the plant-based meat products, that's another thing too. Most, I won't say all, but most of those products are pretty highly processed with a lot of additives. And so those should be, again, something that's just on occasion that you consume. I wouldn't have those products, you know, on a daily basis and replace all your meat that you're eating with these meat-free products. They should still be something that is more infrequent, and you really should focus on more whole plant foods versus meat replacers. And I did want to touch on these AICR recommendations for cancer survivors. The AICR is the American Institute for Cancer Research, and they are an organization that looks at the relationship between diet and cancer, looks at the literature and the evidence, and sees what things that the public can do to help reduce risk for cancer, as well as recurrence or secondary cancers. And they have put out 10 guidelines, again, that they're seeing from literature that can help reduce risk for these things. So being a healthy weight, that's the number one thing you can do behind not smoking, is being a healthy weight. Being physically active, eating that plant-based diet that we've talked about, limiting consumption of highly processed fast foods that are high in added sugar and fat, limiting consumption of the red and processed meats that we already talked about, limiting sugar-sweetened beverages, limiting alcohol, not using supplements for cancer prevention. You can certainly take supplements if needed and if your doctor prescribes, but we don't want you to rely on them for instead of eating your fresh fruits and vegetables. For number 9, that's a very specific population, but mothers breastfeed if you can. And then after a diagnosis, follow recommendations if you can. So if you are after treatment, you know, if you're feeling well, you can kind of start to incorporate these recommendations. If you're not feeling well, I wouldn't rush into it. These are more just kind of for your information as kind of a call to action. We don't expect anybody to be perfect and follow these all the time, every day. It's just a good kind of thing to acknowledge and know that there are these things that you can do to improve your health. Well, thank you very much, and I'm glad you joined us.